Hi, I'm Dr. Gautami Nagabhirava. I'm a psychiatrist. September 10th is the World Suicide Prevention Day, so I'd like to talk a bit about suicide. Now, every 40 seconds, someone dies by suicide. Suicide is the second leading cause of death among 15 to 29-year-olds. Fortunately, suicide is largely preventable. Now, many people believe that suicides are sudden, they occur out of the blue, but that's not true. Majority of suicides are preceded by warning signs, but we must know what they are and how to look for them. Another misconception is that suicides are done only by those with mental illness, but that's not necessarily always the case. Yes, these individuals may have signs of deep unhappiness, but that does not mean they have a mental illness. Another misconception is that if asking somebody about suicide will lead to a suicidal attempt. For example, if we ask somebody, do you ever have thoughts about killing yourself? That means we're giving them the idea. That is absolutely not true. In fact, we must always ask this direct line of questioning. It may even relieve the anxiety around the suicidal ideation and also be a deterrent to the suicidal behavior. Another myth is that individuals who want to commit suicide really want to die, and there's absolutely nothing we can do about it. But this is not true. These individuals often have mixed feelings about dying. They're ambivalent. What they want to do is end the horrible pain that they're in. Another misconception is that people who constantly talk about killing themselves will rarely ever do so. Again, not true. These individuals will leave clues or warnings regarding their intentions. Lastly, many people believe once a suicidal patient, always a suicidal patient. Though previous attempts may increase the chance of another one, this is not always the case. Now, what are the warning signs that we must look out for? What do these individuals talk about? So these individuals may say that they want to kill themselves, they feel like dying. They may also say that life seems hopeless, that there's no reason to live. They may even talk about how they're a burden on other people, how they feel trapped and are in unbearable pain. What are the signs and symptoms that they exhibit, or the behavior that they exhibit? So these individuals often isolate themselves from friends and families. They restrict or withdraw from activities. Sometimes they may even be reckless. So there may be an increase in alcohol and drugs. These individuals may also start giving their things away. There may be too much sleeping or too little sleeping. These individuals may also start searching online for methods to end their lives. They may visit families and friends to say goodbye. What about their mood? Mood can be anxious, mood can be irritable, depressed, agitated. Often you'll see that these individuals have extreme mood swings. What can we do to help a person who may be suicidal? The do's and don'ts. So first is that we must always be aware of the warning signs. We must also offer empathy, show support, be active. We should always be non-judgmental, willing to listen. And most importantly, we must ask for help. What should we not do? We must not ask them why. This may lead to defensiveness. We must not act shocked. This may increase distance between you and them. You must not lecture them on the importance of life. Or you should not debate with them whether this is right or wrong, or whether their feelings are good or bad. You must not dare them to commit suicide. And most importantly, you must never promise to keep this a secret, because you must make sure that these individuals are safe, and then you should contact a mental health professional that can help.